Hello and welcome to today's WorkSafe Month webinar, Industry Snapshots, Workers' Compensation. I'm Stephanie Morawski from WorkSafe Tasmania and I'll be your moderator. Please take a moment to read the following slide about information received today. If you have any questions about today's webinar, please contact WorkSafe Tasmania on 1300 366 322 or email wstinfo@justice.tas.gov.au. I would now like to introduce your presenter, Vicki Tabor, Director Compensation and Communication from WorkSafe Tasmania. A nurse by trade, Vicki has worked in work health and safety and rehabilitation consultancy roles for decades. This experience has included working with the then Workplace Standards as an inspector and auditor in the early 2000s and later as the Principal Advisor for Health and Safety with the City of Hobart. Vicki rejoined WorkSafe Tasmania in early 2016 in the role of Compliance Manager before taking on the Director role in early 2018. Vicki's team delivers projects and events, undertakes audit and compliance activities, facilitates communication and education opportunities, and collects and analyses workers' compensation data on behalf of the WorkCover Tasmania Board. It's that data analysis that is the focus of today's webinar. Welcome, Vicki.
Thanks, Stephanie. Yes, we're in the fortunate position of having decades of industry data reported by insurers to the WorkCover Tasmania Board. This includes licensed insurers, self-insurers and the Tasmanian State Service. This data is collected to a national standard, which means we can compare the work health and safety performance of the Tasmanian jurisdiction with the rest of the country. However, more importantly, it allows us to drill down into the detail of what is happening in industry across Tasmania. This data analytics capability provided the information which helped to shape WorkSafe Tasmania's strategic plan for the 2018-2023 period. The WorkCover Tasmania Board has also endorsed this plan, as it has established a number of strategies by which both entities seek to fulfil their promise to the Tasmanian community of us being safe and well every day. This is the third year that WorkSafe has produced these snapshots. They provide performance data and trends regarding the 19 industry groups we have in Tasmania. They identify and focus on emerging or existing work health and safety issues and compare the most current work health and safety performance relative to previous years and, where applicable, to other industries across Tasmania. For each industry, we consider a number of issues, beginning with the workforce. Here we look at the types of activities undertaken within that industry sector. And the example I've used here is the accommodation and food services sector, where there were four main groups, these being cafes, restaurants and takeaway food services, accommodation, pubs, taverns and bars, and clubs or hospitality. We also consider the total of the Tasmanian workforce employed in this sector. In that context, we look at the percentage of workers who are employed on a full-time basis and how this compares with the state average, where the workforce is predominantly employed, and any other issues that are unusual or specific about this workforce. Again, using the accommodation and food services example, we can see that this industry segment employs about 8% of the total Tasmanian workforce. 36% are employed full-time, which compares to the state average of 62%. Over half the workforce is employed in cafes, restaurants and takeaway food sectors, and 43% of the workforce is aged under 25. So already you can start to see how this information can give you an insight into an individual industry sector. The second issue we look at are the injuries that have occurred in the industry. And in this context, we look at the total number of injuries for this year of 2019. What percentage of these have resulted in at least a week off work in the last 10 years? What's the serious injury frequency rate? Now that's actually the number of serious injuries sustained per million hours worked. So we look at this on its own and also how it compares to the state average. And we also look at whether the 2019 figure is an increase or decrease on the figures of 10 years ago. So if we look at the agricultural, forestry and fishing industry this time, we can see that there were 477 injuries in that industry for 2019. 44% of which in the last 10 years have resulted in at least 1 week off work. The The serious injury rate is 10.8, which is actually 18% higher than the state average of 9.1. But pleasingly, the serious injury rate is actually 8% lower than it was 10 years ago. The third issue that we report on is in relation to the people working in the industry. Here we consider the age group that reported the highest serious injury frequency rate, the occupations within the industry that have the highest percentage of serious injuries, and in which sector within this industry has the greatest number of serious injuries. In this example, we're looking at the healthcare and social assistance area, where we find that 55 to 64-year-olds reported the highest serious injury frequency rate. The occupations with the highest percentage of injuries were health and welfare workers, midwifery and nursing professionals, and personal carers and assistants. In fact, this group has accounted for 1 in 3 injuries in this industry. So it may come as no surprise, really, that 49% of serious injuries in this industry occurred in residential care services. The fourth issue we consider is the cause of injury or illness. This one's pretty straightforward, and realistically we just list the most common causes of injury across that industry. If we look at transport, postal and warehousing as our example for this one, we find the most common causes of injury are body stressing, falls, slips and trips, being hit by moving objects, and vehicle incidents. We then pull all these considerations together to identify action areas relevant to an industry. So in this example, I've actually used construction, and we can see that the action areas for the construction industry are musculoskeletal disorders, hazardous manual tasks, slips, trips and falls, safe movement of vehicles and plant, and for this one, asbestos-related diseases. WorkSafe has also compiled an industry overview report. So this provides an account of the work health and safety performance of each industry group across Tasmania. This provides us with a wealth of information regarding the Tasmanian workforce, not just for the 2019 year, but also in comparison to other years. So if you have a look at this slide there, you can see the percentage of people working in each of those industry divisions, and that half the state's workforce are in fact employed in only 5 industries. Those being healthcare and social assistance, retail trade, construction, education and training, and accommodation and food services. Having a look at the data statewide for 2019, this data relates to approximately 250,000 people employed across the state. There were 7,636 workplace injuries in Tasmania in 2019, and over the last 10 years, injury numbers per year have decreased by 17%. As I said earlier, on average, 62% of Tasmanians work full-time, and this varies greatly between industries. As we noted earlier, 36% of people in accommodation food services work full-time. However, in the mining industry, almost 96% of people are employed full-time. The 45 to 54-year age group makes up the largest proportion of Tasmanian workers at around 22% of the total workforce. And sadly, there have been 81 work-related fatalities in Tasmania in the last 10 years. 59 of these were workers and 22 were bystanders. We can also monitor trends within the data, and this helps to inform where we should be focusing our education, compliance and enforcement efforts. For example, in 2019, body stressing accounted for 37% of serious injuries, almost twice as high as the next most common cause, which was falls, trips and slips. Following these comes being hit by moving objects and mental stress. However, mental stress injuries have increased by 32% between 2015 and 2019. Now, this is actually the highest percentage increase of any injury type. Work-related bullying, harassment and work pressure are reported as the most common causes for mental stress injury. So it would likely come as no surprise that the priority conditions that WorkSafe and the board focus on and the causes identified within the WorkSafe Strategic Plan for 2018-2023 are musculoskeletal disorders, hazardous manual tasks, safe movement of vehicles and plant, slips, trips and falls, asbestos-related diseases, and of course mental health conditions. So make sure that you look at the snapshot relevant to your specific industry. This can be downloaded from our website, printed off and displayed within your workplace. It's not only informative in that it tells the health and safety story of your industry in text and graphics, but it's also a great visual reminder to your staff to keep health and safety front of mind. So if you do need any further information, you can phone us, fax us, email us, or have a look on the website and download these. Thanks for your time, Stephanie.
And thank you, Vicki Tabor, Director, Compensation and Communication from WorkSafe Tasmania for today's webinar, Industry Snapshots, Workers' Compensation. If you do have any questions about today's webinar, please contact WorkSafe Tasmania or visit the WorkSafe Tasmania website. On behalf of WorkSafe Tasmania and the WorkCover Tasmania Board, thank you for joining us.